Hello, everyone. Great to be back for the 6th episode of UEFA's Take Care podcast. If you've been following us, then you know this fantastic initiative uses the power of football to encourage healthier, more balanced lifestyles across Europe. A quick reminder of the topics we have already addressed in this series: physical education, nutrition, mental health, digital addiction, and road safety. Today, we are focusing on substance abuse. This is an issue which affects young people around the world, especially in adolescence, when exposure, experimentation, and risk-taking often begins. It's a period of huge change, physically, mentally, and socially, and the choices made during these years can really impact future opportunities. Research shows that substance use at a young age is likely not only to cause physical damage, but can also lead to anxiety and other mental health issues. What's equally important is understanding the prevention isn't just about saying no, it's about education, awareness, and environment. Studies show that young people who regularly participate in sport and structured activities are less likely to engage in substance abuse, highlighting the powerful role that positive environments, role models, and open conversations can play. At the same time, today's generation faces new pressures from social media influence to increased social expectations, making honest dialogue and support more important than ever. To help us understand the risks, the psychology, and what can actually make a difference, I'm delighted to be joined by Swedish expert and sports psychology professor at Halmstad University, Andreas Ivarsson. Andreas, thank you so much for your time. This is such an important topic. To help us start the conversation and set the scene, so to speak, I would like you to tell us about what are the substances that are most affecting today's youth, according to your experience.
First of all, thank you very much for inviting me. Happy to discuss this together with you. And it's a good question. I think what's interesting today is that even though alcohol is still the most common substance, we can see on kind of overall level a decline in alcohol, but still it's the most common one. If looking at trends, we can see that e-cigarettes and snus seems to be two of the substances that increase in people that are taking it in adolescence.
When it comes to those substances you just mentioned, which ones do you think are the most underestimated? So alcohol's been around for a long time. Obviously, if we go back to other generations, tobacco, when you talk about smoking, obviously is the main threat, but you mentioned e-cigarettes. So which ones are the substances that maybe parents are most unaware of, the dangers?
Yeah, I would probably say that, as you said, that you can see that the traditional tobacco use is going down. But I would probably say the e-cigarettes and snus or those type of substances that might not directly influence you in a way, or you can't really see that it influences you, but still it can have huge impact on both short-term well-being in terms of sleep, for example, but also long-term. So I guess the newer ones that perhaps are a little bit packaged differently than the previous ones are the ones that perhaps should gain more attention today.
When you talk about snus tobacco, I'm very well aware of it because I've had many Swedish friends and I've been to Sweden, and it's quite popular in Northern Europe now for several decades, I would say, but maybe it's becoming more prevalent around other areas of Europe. Would you like to define that for maybe the people in our audience that aren't as familiar when you talk about snus, exactly what that is?
Yeah, sure. Now you're probably right. Even if we can see that it's spread out through Europe, it's definitely the northern countries where are more common. So it's nicotine that you put under your lip, and it seems, at least in Sweden, it's quite common, from my experience at least, in team sports, so soccer, ice hockey, and so. I think one of the reasons why it's more and more common in those type of sports is that it not, as I said before, it's not really directly influence you in a way that alcohol does, or that kind of perhaps more heavy substances does. So it's easy way to get the nicotine kick in a way, and it's not really smoking. So you kind of can have it while you practice, or it doesn't tell just as much as other things does.
Understood. Thank you for that. You're in contact with a lot of young people through your work and through your career, Andreas, and it'd be interesting to get your perception of the additional challenges that this particular generation has when it comes to substance abuse and maybe having or not having substance awareness, because we have so much information available to all of us, right? So children and young adults and adolescents are aware of the dangers of some of these substances, if not all of these substances, because of all of the information that is in their environment. Still, they continue to choose to practice certain behaviors which are unhealthy. So what kind of behavior do you see in this generation maybe, and why do they continue to choose to use some of these substances when they know perfectly well what the dangers are, when perhaps in the past other generations didn't, because that information wasn't as available?
No, it's a very good question. And as I said, there's a lot of information out there. But if information was everything, we wouldn't exercise risk behaviors at all, I guess. So information, no matter what it is not enough. And I think today, when we have everything so easy accessible in social media, and so you have, of course, the posts or the information about the risks, but also it's a lot of social media posts, for example, glorifying a bit the substances, perhaps mostly the alcohol. So I guess you get exposed to a lot of different things, and it's not just the negative ones; it's also the positive ones that might influence you and downplay a little bit the risk. Also today, it's just, I guess I have, but so alcohol, for example, and other substances as well might be a social drug in a way. So it's one way to lower the boundaries of interacting in a social way. And today, when we perhaps not interact the same way always as we did before, it might also be an entrance to socializing. In a way.
It's a very good point, because social media and digital interaction tends to magnify everything, right? So it can magnify information in one way, but it can also magnify the interaction that adolescents have with a lot of these products, and the glorification of it is actually a very interesting component of that. Tell me about the added challenges that you think and you see adolescents are having these days when it comes to dealing with the pressures of trying or not trying certain substances, and how having a device in their pocket that literally gives them access to whatever they want can have as well.
Yeah, it's of course lowering the stairs to get access both to information, as you said, and it could be both positive and negative, but also, of course, to get access to the substances themselves. It's probably much easier today than it was before. So if you are prone to risk behaviors in this example, substances, you might get more possibilities or opportunities today to get access to them. And also, I guess it's the same during history that using substances have been heavily driven by peer pressure, by being in a social environment where it's acceptable or accessible to do those things. And if the opportunity to get the substances are increasing today, I guess it's also more situations where you actually can access them, and when perhaps the pressure to take them or to be involved in those specific societies might increase.
Tell us about how substance use can affect not only physical health, but also motivation, mental health, confidence, and how you see that in today's youth?
Yeah, as you said, it's not just the physical health, so it's also psychological, social health, and so on. And what we can see in research, for example, we can see that substance use affects both sleep, cognitive function, and emotional regulation and motivation in negative ways. You'll be less equipped to deal with the stressors or obstacles you face in everyday life, and if you can't cope with those, the risk for different type of psychological problems are likely to increase. So both in a short term, I mean, with sleep, but also in a long term, not being able to adequately cope with the situations might influence mental health in the long term.
What kind of advice, Andreas, do you have for parents, for educators, for coaches, maybe, that have seen a visible example of a young person who is showing behavior that is connected to substance abuse? What is the right way to approach it? How should they do it?
I think in general, in the kind of first steps, it's of course important to provide information, but also to acknowledge what behavioral patterns that are kind of acceptable. But what's not so effective is kind of to just to talk about risk or to scare people, because that tends to be less likely to influence behaviors. So adopt a more perhaps constructive way, and to actually communicate and discuss, have a dialogue around those things seems to be much more effective in preventing substance use. So not just scare them, talk with them is probably a good first step. Then, of course, if you see people that have problems with substances, a good next step is actually to be in contact with professional help in a way, because if it's a pattern or behavioral pattern that have gone quite far, it's important to have someone professional to help to deal with it.
Is there an advisable age where parents or adults should approach the subject with young people? Obviously, different adolescents evolve at different speeds, right? And there's different stages of maturity. But is there kind of a window of age where there should be that first conversation about some of the threats that could exist in their environment and how young people can deal with them?
It's a very good question. As you said, it's probably could be quite differently depending on the development. But I somewhere in early adolescence, 13, 14 years of age, when you're actually starting to get exposed, perhaps in general, of those things, it might be a good time point to start a dialogue.
Throughout this series, we've been talking about the importance of sport and football to promote health and well-being. When it comes to practicing sport, what benefits can that bring, and how can that help young people resist trying and exploring substance use?
Yeah, as you said, so what research has found is that sport or participating in organized sports have several benefits, both physiological, of course, but also social, emotional, and so both in short term. But actually, the longest studies are 30, 40 years prospective, when you see that if you are active when you're young, you're more likely to exercise healthy behaviors also in adulthood. And that's probably what I want to emphasize, that it seems like if you are in sports, it seems that you also, those positive, healthy behaviors are more likely to also spill over on everyday life. So it seems like sport have a proactive health way with increasing the number of health behaviors that you're actually exercising, both in short term and also in long term.
And tell me about the importance of young people having role models, whether that's parents, whether that's coaches, whether that's teachers. How important is it for them to have someone who they see as a reference, someone who they aspire to be? And what advice do you have for us adults in becoming role models like that?
Yeah, role models are very important in terms of influencing behaviors for adolescents. And as you said, it could be either a coach, a peer, parents, and so on. So I think it's important to acknowledge that what you do as a role model is very important, because it's more likely that you as an adolescent do as others than if you just say something. So I think to be very clear on how you act as a role model is very important. Also, that you establish a trustful and empathic relationship with adolescents is very important, because if you feel cared for, it's also more likely that you adhere or listen to the role model. So to take time to establish good relationships are also a very central piece when discussing role models.
Going back to some key messages that you can share with us on how we can deal with this issue, and especially when it comes to adults dealing with young people who they may be concerned that the young people could be tempted to use some substances or are using some substances. I remember from my youth, the message when it came especially to drugs, alcohol as well, was just say no. Nowadays, just saying no is not good enough, is it, as a message to give to young people? How can you build on that message and work on the education side of it rather than just say, don't deal with it, it doesn't exist? Because with persistence of being exposed to a particular situation or temptation, that just say no might not be enough, right? When you tell your friends no, when you tell people who could have influence on you no. So what else can you add to that just say no message?
I think it's important to frame it in a positive way, so to speak, not the no message, but more, okay, what benefits do I have if I say no? So I think there also sports might have an advantage, because I guess most adolescents in sports aim to be a professional athlete in the end, and to show that you have benefits of not drinking or not taking substances might be one way to actually, in a more positive way, frame why you should not get involved in the substances at all. So I think that's both perhaps connected both to health but also to performance, because performance, if you are in sports, are something quite vital, and the development as well. So to show or to discuss the benefits from a performance perspective might be one way to also frame it a little bit differently.
How important is it for young people also to pick the right community they're associating with in order to lead to the right behaviors and the right choices in life when it comes to this topic?
Yeah, social interaction and social agents are influence our behaviors in a substantial way. So, of course, the environment you are in will heavily influence what you decide to do. So if you have a community where no one taking substances, it's much easier and it's less likely that you get exposed to the possibilities. But I also think it's important, for example, in a football or sports setting, that to work with the environment, because you can do a lot by working continuously with norms, with collaboration and so on. So I think it's a good possibility also for coaches, organizations, and so to work with the players to actually discuss, for example, substances and how it might affect you and so on, to build that awareness and to also together collectively build the norms that hopefully are positive, that will influence the likelihood of making good decisions.
Finally, if I were going to ask you to give adults, whether they're parents, teachers, coaches, one piece of advice on how to approach some of these tough conversations they need to have with young adults, what would that advice be? How do you approach a topic such as this without being shut off?
I think what's most important is to have a open dialogue, to actually not shy away from the topic, so more invite to a discussion around it, and to be there if someone wants to talk. If you have, as an adolescent, a problem or you feel unsecure, and so that you have someone where you have a relationship that builds on empathy and caring. And if you have that, I think it's much more likely that you also, when you perhaps have doubts, will come to seek advice. So to establish those type of relationships and to have open dialogue, I think it's essential.
Andreas, thank you so much for sharing your insight, your expertise on this topic. So important to really have this advice shared as far and wide as possible. And obviously, football is such a powerful tool, right? It has such a big audience that if we can continue to engage with experts such as yourself, it really adds a lot of value to the conversation as we try to help young people and adolescents in the choices they make in their everyday lives. So thank you so much in the name of the UEFA Take Care podcast for joining us as a guest, and best of luck and continued success with your life and career.
Thank you very much.
And that brings episode 6 of UEFA's Take Care series to a close. Hope you enjoyed this conversation with Professor Andreas Ivarsson. If you want more information on the whole series, you can get it online at uefa.com/takecare. That'll do it for me. Take care. We'll see you again soon.